Welcome to the Breathing and Sleep Center. My name is Dr. Kevin Goles, and I'm here with you today to talk about non-surgical treatment options for airway and sleep issues that can present as so many different symptoms. With Western society, we all suffer from some kind of issue, whether it be seemingly benign as snoring or mouth breathing, crowded teeth, and chronic allergies, to things that are a little bit more serious, like high blood pressure, thyroid issues, depression, anxiety, to things that are even more serious, like stroke, heart attack, cancer, and dementia. A lot of these things that can look so different can be linked down to a similar root cause. And a lot of times that root cause is more related to your quality in breathing and sleeping at night. But with Western medicine, we typically treat the symptoms, and usually via pharmaceutical. We're not actually getting to the root cause. And a lot of times these symptoms can be linked to a compromised airway. So if we're breathing more out of a coffee straw instead of a garden hose, you can imagine how much more difficult that oxygen is to get down to our lungs and the rest of our body. And we can go 3 weeks without food, 3 days without water, and 3 minutes without oxygen. So if we're hypoxic or starving of oxygen for a third of our life when we're sleeping, you can imagine what that's going to do to us and our health moving forward. Aside from that, when we look at our sleep, we have 4 stages of sleep. We have our wake stage, light sleep, REM, and deep sleep. And REM and deep sleep is where we have the most restorative aspects of our sleep. That's also when we're more likely to have the apnea. And so when we stop breathing, a lot of times our body will wake ourselves up out of that deeper stage of sleep to put us into a lighter stage of sleep, okay? And that essentially creates sleep deprivation. And sleep deprivation, even aside from sleep apnea or any other sleep disordered breathing, that can affect every aspect of our physiology. So we know it can affect our immune system, our cardiovascular system, reproductive health, and even all the way down to the biological fabric of life, which is our DNA. They did this study where they took a control group that slept 8 hours a night for 6 straight nights, and then a study group that slept 6 hours a night for 6 straight nights. And they saw that in that study group that only slept 6 hours, they had 711 genes affected during that sleep deprivation. And half of those genes were downregulated, and half of those genes were upregulated. The genes that were downregulated were essential for immune function, and the other half that were upregulated during the sleep deprivation were precursors to tumor proliferation, chronic inflammation, and cardiovascular disease. So sleep deprivation in of itself is like a flood in your house, where it gets into every nook and cranny of that house. Sleep deprivation does that exact same thing in our physiology. There's not a single part of our brain or our body that isn't affected during that sleep deprivation. So if we're looking at these symptoms and trying to figure out what's creating a lot of these, if we're breathing more out of that coffee straw instead of that garden hose, it starts to make sense. But why do we have these compromised airways? Well, we've created this issue over the past 100 years or so. If you think about your airway, that is a tube that goes down your throat, and that is surrounded by a bunch of soft tissue. That soft tissue is supported by your jaw bones. If we have these jaws that are underdeveloped and or held back, that's gonna have that same effect on that soft tissue, which is then gonna obviously make us breathe more out of a coffee straw instead of a garden hose. And the reason why we have these small jaws is because of the way we raised our kids over the past 100 years or so. Because even now, a lot of moms have very limited or no breastfeeding. But when a baby is breastfeeding, they're using their tongue and their lips and their cheeks to get the milk out of the breast. And as they do that, they develop all the muscles of the face. As they develop those muscles of the face, that develops a jawbone underneath it, and that develops your airway. So if we think about working out, when we start to build up more muscle, the bone underneath it is going to be deposited, so you have bigger bone to support that bigger muscle. So form of the bone is following function of the muscle. So if we're not using that muscle, we're not going to develop that bone underneath it, such as the jawbone, and that's not going to develop the airway. So if we give a baby a bottle instead, and you turn that upside down, that bottle starts to drip. And you put that bottle in the baby's mouth, it starts to drip. And all they have to really do is swallow instead of actually developing all these muscles of the face that develops the jawbone and develops the airway. Also, we're so concerned about our kids choking early on in life that we're giving them these processed pureed foods. And if we put that in a cup or a spoon and we put that in the baby's mouth, all they have to do is swallow instead of actually learn how to chew and function and developing these chewing muscles, which develops the jawbone and develops the airway. So when we look at the airway, our airway is what we breathe out of through our nose, behind our tongue, and into our lungs. And if things aren't developed appropriately and we have these small jaws here, then everything else is going to be pulled back as well, and we're going to start to obstruct that airway. So the size of those jaw bones has a direct effect on the size of that airway as we look at here. So if we look at Stanford University, they were the first ones that identified sleep apnea in 1972. And since then, they've always been one of the leading researchers when it comes to sleep apnea. And this is a recently published article that they had that talks about this hidden epidemic of shrinking jaws is behind so many of the reasons why we have crowded teeth and other health issues. And it's a lifestyle disease, not a genetic one, okay? Here at the Breathing and Sleep Center, we see kids as young as 2 to adults as old as 80. But when we look at some of these kids are starting to struggle already in life. And if they don't get proper intervention, they're going to only progress. Because with sleep apnea, it is typically a progressive disease, meaning it's going to continue to get worse as we age. And these kids are already starting to struggle. As you can see on this kid on the left-hand side, he already has a double chin, his lower lips protruded out, and he's carrying a lot more weight in his face. And I'm going to come back to him a little bit later. But this girl in the middle, she has the bags under her eyes, she has a little bit of asymmetry with her eyes as well, and chapped lips and a dimpling of her chin, and she's definitely more of a mouth breather. And you can see how tired she is. And then same thing with this kid on the right-hand side, you can see his chapped lips and double chin. If he wasn't 12, I'd probably be scared of him. But these girls are all starting to struggle as well, okay? And if they don't get proper intervention, they're gonna continue to suffer throughout the rest of their life. And hopefully they're also not a victim to traditional braces and orthodontics, because traditional orthodontics is very retractive in nature, meaning it's bringing things into the tongue space and back into the airway, when ideally we want it more in an expansive manner. That's how we're supposed to grow anyways. So when we look at the normal growth of the skull, this inner line is where we are at when we're 2 years old. And then we grow to this outer line once we're 17 years old. So if you look at all of that growth and development, that's all happening in the mid to lower third of the face, which is essentially your upper jaw and your lower jaw. So that's supposed to be developing downward, forward, and wider. But if you're stuck on one of these lines back here, then everything else gets pushed back as well, and all that anatomy in your mouth and the back of your throat gets pushed into that airway, and now you're breathing more out of a coffee straw instead of a garden hose. Or if you have some retractive orthodontics, that can bring you back as well into one of these back lines, and that's gonna push you into that airway and make it a lot more difficult to get air through your airway and into your lungs. The crazy thing is that most of this growth and development happens really early in life. You're about 75% developed in the growth of your skull by the time you're 4 years old. So that's why those habits early on in life have such a drastic effect on the development of our airway and the prevention of sleep apnea and other sleep disordered breathing. So you're about halfway developed in the growth of your skull by the time you're 2, 3/4 of the way grown by the time you're 4, and then we're almost done by the time we're 12. So if we look at someone's face and we cut it in half, this is the front of their face, this is their hard palate and their soft palate, and this is their tongue. If all these structures here aren't developed downward and forward like they're supposed to be, they're gonna start to be held up and back. And you're gonna start to see all these structures here are gonna get pushed into that airway, and now you're breathing more out of a coffee straw instead of a garden hose. So if we look at Western society as well, it's almost like a rite of passage for our kids to be in braces to have straight teeth in middle school. We didn't always need to have braces in order to have straight teeth. So Dr. Curacini, he's an anthropologist who's done over 35 years of research now, and he looked at the human skull from 400 years ago and compared it to the human skull of today. And that human skull 400 years ago had all 32 teeth, including their wisdom teeth, fully erupted with perfect function and perfect alignment. And there's no such thing as an orthodontist or an oral surgeon back then. Fast forward to today's world, now we're taking out wisdom teeth and sometimes bicuspid teeth to create the image of straight teeth. When the real problem is our jaws are too small. Because our jaws are what develop first, and the teeth come in the space that they have. If there's not enough space there, then they crowd together. So that's how prevalent a lot of these airway issues are. If you have crowded teeth, that usually means your jaws are too small, which means your airway can be too small, and that's gonna predispose you to having sleeping and breathing issues down the road. He also did this study with this rural population that had never been exposed to Western society. So naturally, they lived very primitively. They breastfed for 4 to 6 years, they lived off the land eating meat and roots and these hard foods, and they had no crowded teeth and no degenerative diseases. They had these perfectly formed jaws similar to those from 400 years ago. And it was their lifestyle that created this characteristic for them. But then when they got exposed to Western society and took on our habits with processed foods and bottles and formula, that next generation, 50% of them started to have crowded teeth and degenerative diseases. The next generation, it was 70%, and the next generation was 85%. So welcome to Western society. And we know it's an environmental issue, not a genetic one. And it's all because of the lack of breastfeeding, the bottle feeding, and the soft diets, when it should look more like this. There's a thing out there called baby-led weaning, where as long as your baby can sit upright, then you can give them the same foods that you're eating. So we've talked a lot about the structural component of our airway. But like what I talked about earlier, What really drives that structure is the function of the muscle, because form of the bone follows function of the muscle. So the way we should be breathing all day, and especially all night, is through our nose with our mouth closed and our tongue resting up against the roof of the mouth. And if we're breathing like that, say early stages of life and development, if our tongue is up against the roof of the mouth, our jaw is going to form around the shape of that tongue. That tongue is pushing everything in an outward direction, while at the same time, those lips and cheeks are going to pull everything back. So our jawbone is going to find this happy place between your tongue and your lips. But say you have really bad allergies and you have to become a mouth breather, or you're tongue-tied, or for whatever reason, your tongue is sitting down in your mouth instead of up against the roof of the mouth, then the only force that's acting on this developing jaw are those lips and cheeks that are going to pull everything back, and you're going to get an arch that looks like this. A very narrow, V-shaped, high-vaulted arch, because there's only those lips and cheeks pulling everything back. There's no tongue up there to help develop that jaw, as opposed to this nice, wide, broad, U-shaped arch with a shallow palate, because the tongue was actually up there helping develop that jawbone. And if you have this wide palate, if I look at this inverted jaw here, the roof of the mouth is the floor of the nose. So if you have this wide, shallow palate, that's going to give you a lot more nasal volume as well, compared to this very narrow, high vaulted arch, where you have a lot smaller of a surface area and a lot smaller nasal passage. The other aspect of this is looking at our sleeping stages. Like we said before, REM and deep sleep is when we have our more restorative aspects of sleep. But in REM, that's our brain sleep. That's when we're going to process new information. It's important for learning and emotional and mental health, and it's also when we dream. However, when we go into REM sleep, our body goes into a complete sleep paralysis, so we don't have to act out our crazy dreams. So the way we maintain our airway when everything is paralyzed and things can fall back in your airway, the way you actually keep your airway open is your tongue will suction up against the roof of the mouth. But if you're someone like this, who has this narrow or held back jaw, you're already going to have a small airway. And then when you try to go into REM sleep and your tongue goes to suction up against the roof of the mouth, there's no space for it. So the only place that tongue can go is back into the airway. So, Dr. Guilleminault is one of the founding fathers of sleep apnea out of Stanford in 1972, and he talks about how maxillary expansion is a valid treatment for that airway constriction. So the maxilla isn't just the roof of the mouth, it's also the floor of the nose. It's part of the cheekbones, the floor of the orbit, and the side of the nose. But we were taught that once you're 12 years old, that these sutures in your skull are fused together. And the only way that we're going to create expansion is by literally breaking your jaw, moving it forward and wider, and sometimes wiring you shut for 6 weeks. But that's been disproven many times over. So where these sutures come together, those don't even start to fuse until the early 80s. Also, these sutures are rich with stem cells. So we have an appliance that can actually stimulate those stem cells and reinitiate the growth and development of those jaw bones, so you can breathe more out of a garden hose instead of a coffee straw. The idea is you wear this appliance for 1 to 2 years that can stimulate these stem cells, and by the end of it, now you have a much bigger airway to breathe out of and can actually reverse a lot of these sleep apnea issues. The appliance that we do use is from a company called Vivos, which is based out of Denver. Me and my partners were one of the first ones to go through training when they came around, and we've done the most cases in the United States here in this office. At the recording of this video, we've done over 750 cases with this type of treatment. However, that's only one way that we can treat the sleep apnea. Dr. Guilleminault also trained one of my other mentors, whose name is Dr. Zaghi, and he is an ear, nose, and throat surgeon in Los Angeles and owns a company called the Breathe Institute. And Dr. Zaghi went through Harvard Medical School, went to UCLA for his residency, and then went to Stanford to become a sleep surgeon. So he was going to go in there and break people's jaws to open and expand those arches to have a bigger airway. But Dr. Guilleminault was his mentor and was like, hold on, Zaghi, you don't have to be so aggressive with your treatments. So what they did is they put their patients through something called myofunctional therapy. And what myofunctional therapy is, essentially, is physical therapy for your tongue, lips, and cheeks. The whole orofacial structures, we're gonna be retraining those muscles. And ideally, when you retrain those muscles and create more strength and flexibility to those muscles, we can teach those muscles to stay out of the airway when you sleep. So when they put their patients through myofunctional therapy, they were able to cure a lot of that sleep apnea for these patients just by retraining and creating new habits of those muscles. The only problem is a lot of people plateaued out during that myofunctional therapy. And that's when Dr. Zaghi realized a lot of people had an undiagnosed tongue tie. a little band underneath your tongue, you can have a posterior tongue tie where it's further back and deep and not as obvious. But if you have a tongue that's restrictive and you're trying to go through this myofunctional therapy, that's like the same thing as doing physical therapy on your legs with your shoelaces tied. So what Dr. Zaghi did was went in there and released these tongue ties as they're going through myofunctional therapy, and they gave the tongue a lot more range of motion, so now they could maximize that therapy, and they were able to cure even more people. The only problem is they made some people way worse. Why? Well, you give the tongue a lot more range of motion with nowhere for it to go. The only place that tongue can go is further back in the airway. So a lot of times I have to build that garage big enough first before I park that car inside of it. So are you breathing through a coffee straw or a garden hose? But the other aspect of this is getting you to breathe through your nose. You could have the biggest airway in the world, but if you're breathing through your mouth, then everything's gonna fall back. Because like we talked about earlier, the way you maintain your airway in sleep is your tongue suctions up against the roof of the mouth. But if you can't breathe out of your nose and you breathe out of your mouth, then when you actually lean back, everything falls back into your airway. So one of our number one goals in this whole treatment is to improve your nasal volume. One of the things I always joke about is we should be breathing out of your mouth as much as you eat out of your nose. But when we think about our nasal breathing, that's our first line of defense for our immune system. When you breathe through your nose, that air gets warmed and filtered and humidified. It also mixes with your maxillary sinus and secretes nitric oxide. Nitric oxide is very important for many reasons. First, you get about 30% more diffusion of oxygen into your lungs when that air is coupled with nitric oxide. Nitric oxide is also a potent vasodilator, so that opens up your blood vessels so that oxygen can get delivered throughout the body, and it also helps with blood pressure. The other thing is nitric oxide is an antiviral and antibacterial, so it kills off things like the common cold, the flu, and even the coronavirus, according to the Journal of Virology. But the only way you produce nitric oxide is by breathing through your nose. If you breathe through your mouth, you skip that whole process. That air is not warmed, it's not filtered, it's not humidified, and you have no nitric oxide secretion, so it's full of pathogens. So this raw, cold air full of pathogens, the first thing it hits is the back of the throat, the lungs, the tonsils, and the adenoids. And that can aggravate a lot of asthma issues and bronchitis, a lot of allergies, and it can cause those tonsils and adenoids to get further inflamed and big as well. And when those get big, then those further block the airway, and a lot of times the ENT has to go in there and remove those. But if you don't take care of the reason why those were big in the first place, like for mouth breathing, those adenoids can actually grow back. So we have to make sure we actually take care of the root issue before we go through something like that as well. So if we're mouth breathing, if I'm looking through your face, this is your tongue, these are your back teeth, and this is your upper jaw. If you're breathing through your mouth, then this becomes your airway, and your tongue has to stay out of the airway. And now it's no longer going to be up against the roof of the mouth and develop that jawbone and develop that airway. So now when everything is a lot more narrow, now you're going to be biting the sides of your tongue because it's literally fitting in between the biting surfaces of your teeth. So a lot of times when I see a scalloped tongue with indentations on the side of your tongue, that usually means that your jaws are too small. It's not that your tongue is too big. Obviously when you mouth breathe as well, like we talked about, that can create a lot of inflammation and infection of those tonsils and adenoids. Those will further swell and block the airway. They did one study with these monkeys, and they watched them for a year after they plugged their nose with cotton rolls. And what they were doing is seeing what happens when we force them from nasal breathers into mouth breathers. So as they started to develop after that year of plugging their nose with cotton rolls, they started to get a tongue thrust and even a bigger tongue thrust. The reason why is because now there's no space for the tongue on the roof of the mouth. So either it's going to fall back in the airway or they have to thrust it forward in order to breathe. So a lot of these tongue thrusts are actually an airway issue. Same thing with the kids that are always sucking their thumbs and fingers. They're just trying to open up their airway because as you create more vertical dimension of your bite, that's going to open your airway and they're going to thrust their jaw forward too in order to be able to breathe. So the kid immediately when they put their finger in their mouth, they can breathe better. But we know a lot of other issues that can come from chronic thumb sucking and finger sucking. But if we look at, some of the issues that these kids are dealing with, obviously the ADD and ADHD discussion is pretty rampant. But when we look at ADD and ADHD, it seems to be more of a symptom than necessarily a diagnosis. Yes, there are neurological aspects that can affect ADD and ADHD, but there was a study done with over 11,000 kids, and the kids who had sleep disordered breathing were 60% likely to get diagnosed with ADD and ADHD and treated with a medication. That's more than a coin flip for your kid to be on amphetamine. Also, as they're watching these kids over these 7 years, from 6 months old to 7.5 years old, their IQ was actually dropping during that time frame with sleep disordered breathing instead of increasing during those formative years. So a lot of these issues can be linked down to their quality of breathing and sleeping. Another aspect that a lot of people might not talk about is bedwetting. About 20% of the population, 15 years and younger, has a bedwetting issue, which you might not hear about that much because you're not going to brag about your kid wetting the bed. But we see plenty of 9-year-olds, 11-year-olds, 13, 14-year-olds that are still wetting the bed. And the reason why that's happening is because when you have sleep apnea, your body goes into this fight or flight response. When it stops breathing and it's like, and it gasps for air, your heart rate spikes and your blood pressure is going to spike. When that happens, your body thinks there's too much volume in your circulatory system and it needs to void. So it's its own personal diuretic. Also, when you're in that fight or flight response, your body doesn't know the difference of what's creating that fight or flight response. We don't know if it's a grizzly bear, or someone's choking you out, or you're just losing your airway in the middle of the night. When your body's in that fight or flight response, it is in survival mode. It's getting ready to fight that grizzly bear or run from the grizzly bear. So when that's happening, it's taking resources from other parts of the body and putting it in other parts of the body that are important for survival, like your musculoskeletal system, your heart, and your eyes. But your digestive tract and your urinary bladder and the little sphincter that holds that all together is not important for survival. So you're going to be more likely to void because you don't have the control over those mechanisms. If you think about the people at Cedar Point that goes on those crazy roller coasters and you see they come off and they literally peed themselves, because literally right when that roller coaster is about to go down, they go into that fight or flight response and literally void. So that's where a lot of this comes into play. But yes, eventually you grow out of bedwetting, but now that looks like you waking up 2, 3, 4 times in the middle of the night to go to the bathroom. And that's a tall tale sign that you might have some sleep disordered breathing going on. It's not that you just drank way too much water. But when you look at sleep apnea, it is a very serious condition. So if you get diagnosed with severe sleep apnea, which is this maroon line here, what this is looking at is mortality rate over the next 15 years. And those with severe sleep apnea, there's a 45% mortality rate over the next 15 years from only a cardiovascular event. We're not even talking about the cancer issues and the immune system issues and everything else that can come from sleep apnea. So one of the ways we treat sleep apnea is through maxillary expansion, development of that entire midface. And one of the ways we do that is through a company called Vivos. And here at this office, we've done the most cases in the United States through Vivos with over 750 cases under our belt. We're also clinical advisors for this company where we are teaching new doctors how to treatment plan, diagnose, and do case design for this type of treatment. As I develop that whole midface, the roof of the mouth is the floor of the nose. So I create a lot more space for the tongue, and as I do that in the roof of the mouth, we actually open up the nasal passages as well, which can improve nasal volume. And from what we talked about earlier, that's another really important aspect of sleep apnea. Dr. Guilleminault, who we talked about before, says that anyone who has sleep apnea, we need to address their nasal volume. Also, as I develop that whole midface, I actually decompress those sinuses and can help actually drain those sinuses and fix a lot of chronic sinusitis issues. Also, this can help a lot of TMJ disorders, because if you think about it, the upper jaw is the key to health and beauty. It's going to be the foundation to your airway and give you the facial profile. Your lower jaw's job is to fit into the upper jaw. So if your upper jaw is narrow and held back, your lower jaw is going to do the same thing to try to fit into that small jaw. And it's going to push this jaw joint back. When that jaw joint gets pushed back, then the disc that sits between that joint and the base of your skull can get dislodged forward. And so whenever you open, you click and recapture that disc, and when you close, you lose that disc again. And at the back side of that jaw joint is where all those sensitive tissues are and can create a lot of other headache symptoms. As I show in these pictures, these are some of our before and after pictures where I'm looking through the face. So this is the nose, these are the eyes, these are the sinuses, your tongue, and your teeth. As you can see here, that's where all that chronic mucus is sitting in the sinuses. As I develop that midface, you can see how that completely drains. And we've done this time and time again. As you can see how this one is completely full. As we go through treatment, it can completely empty. And we see this time and time again. So If you have chronic sinus issues, this could be a big help without having to go through some of the surgical options. This is where a lot of this technology comes from Dr. Singh, who's written a couple of books on how we can actually expand and develop that maxilla without surgery. So Dr. Singh is actually an orthodontist who created this technology over 20 years ago when he did a lot of cleft lip and palate research. He's also published hundreds of articles on this type of treatment, where we can do non-surgical expansion. So these are some of the appliances that we use to non-surgically develop that upper jaw. It looks like a retainer that's removable, and the springs that engage with your teeth stimulate the stem cells that live where your bones come together in your skull. And so if you wear that for 1 to 2 years, that stimulation is creating that growth and development. Your body has a genetic map of where it wants to go. We're just turning on the car to let it go there. Another mechanism of this as well is the fact that when you put it in, it's creating outward pressure. When you take it out, it creates relaxation. And the cyclical loading of pressure and relaxation is also helping with that bone growth. But ideally, you want to wear this for around 14 to 16 hours a day, but it does not need to be consecutive. If you sleep 8 hours at night, there's 8 hours right there. And then if you can find another half hour, a couple hours throughout the day, the more you wear it, the quicker you grow and the quicker you get to that end result. The cool thing is we also can incorporate jaw support while you sleep. So as we're developing the upper jaw and taking care of the root cause, we can still give you instant symptom improvement by helping that lower jaw stay forward while you sleep so it doesn't fall back into your airway. Another way that we can create more tongue space is through clear aligners. Clear aligners are these little clear retainers that you put in your teeth that can actually help straighten your teeth at the same time. A lot of times these aligners will have buttons on their teeth, but when you have buttons on your teeth and you're actually grinding in between the teeth as well, that's a retractive type motion. And as we know, we want things to be in an expansive manner. We want things going forward and wider to create more tongue space and a bigger airway. So like we talked about before, we want things more expansive rather than retractive. We want to create more space for the tongue so the tongue doesn't get displaced back into your airway. So a lot of times when we are using these aligners, we're not using any kind of buttons. It's actually very clear and you can't even see them on your teeth. But the only thing that this does is create more tongue space. It doesn't grow bone like we do with those other appliances that I showed earlier. When I need to improve nasal volume, that's when I'm more likely to go through those expansive appliances, because as I grow that bone, I can open up those nasal passages and the sinuses as well. This can create straight teeth, but it's only giving you more tongue space. And when we do create more tongue space, that might be just enough. And then we can just go through myofunctional therapy, like we talked about earlier through Dr. Zaghi's protocol, to teach that tongue to stay out of your airway. There's many different ways to approach this, and each person has their own individual treatment plan. That's why we highly recommend you come in for a records appointment so we can determine which treatment option is best for you. So if you remember this kid in the beginning, you don't just grow out of a double chin. As we talked about before, the upper jaw is the key to health and beauty. That's going to give you your facial profile and the foundation to your airway. Your lower jaw's job is to fit into the upper jaw. If that upper jaw is narrow and held back, then that lower jaw is going to do the same thing, and it can give the appearance of possibly these little rolls underneath your chin. As I develop that upper jaw three-dimensionally, that untraps that lower jaw to where that can rotate down and forward. As this upper jaw comes forward and wider, now that lower jaw can rotate down and forward, and that can create a much more definitive jawline. As we develop that upper jaw and that lower jaw, now his airway is opening up as well, and now he can breathe and sleep better. So as you can see, now his hormones are in better balance, and he was able to lose a little bit of weight as well. These photos are showing how things can actually develop and straighten those teeth without braces. This is just developing those jaw bones appropriately. There's different treatments for every age, so that's why we need to go through a full workup as well. So if we look at x-rays before and after, you can see what his airway looked like before to what it is like now. And what you also notice is his cervical spine. His cervical spine is super curved because what he's doing is putting himself in a CPR position just to breathe. Head tilt, chin thrust. Because if he was in a more neutral position, that lower jaw is going to fall back even further and he can't breathe. So he has to walk around all day long with his head like this in order to maintain his airway. But once we develop that jawbone appropriately, now we can maintain this nice open airway, and that's going to save him a lifetime of neck and back issues because now he has this nice neutral spine. So a lot of the physical therapists and chiropractors that we work with, a lot of times they might do some adjustments on people for a long period of time, but nothing ever sticks. And I always ask them, did you look at their airway? And they ask, why would I look at their airway? Well, you get them all nice in this perfect position in your chair, but then they go to walk out of your office and they're like, I need to breathe again. So what your body's gonna always do is choose breathing over anything else, whether it be your posture or your sleep quality. So that's the one thing it's gonna always protect because it's literally the foundation of life. So this is one of our patients that we've treated who is 49 years old, who went through that growth appliance therapy that I showed you before. So if we look at this x-ray, this is the front of his face, these are his front teeth, that's his hard palate and his soft palate. We're looking at him from the side. And this is his tongue that's gonna fold in half and attach down there. Behind his soft palate, I wanna see at least 10 millimeters of space. And behind the base of his tongue, I wanna see at least 13 millimeters of space. Once he went through this growth appliance, he went from 5.5 millimeters behind his soft palate to 10.6, and the base of his tongue, he went from 6.9 to 13.3. So that's a garden hose versus a coffee straw. And if I look at this same patient, I can do an airway rendering and plop this out three-dimensionally. And you can see how skinny this airway is from side to side in this picture compared to where he is now. His airway volume went from 7 cubic centimeters to 19.7, and the bottleneck of his airway, called the minimum axial area, went from 40 squared millimeters to 199. Another thing we talked about before was the adenoid inflammation. So with this 9-year-old, this whole area here should be black, but that gray area is actually the inflamed adenoid that's almost touching the back of the soft palate. So they were gonna have to have those adenoids and tonsils removed, but the mom came to us to see if there's any other options. As we went through their treatment over 6 months, behind a soft palate, it went from 4.7 to 10.7 as we developed that upper jaw and got them breathing through the nose. Once we improved the nasal breathing, you can see how his adenoids shrunk in half. So we were able to save him the tonsil and adenoid removal surgery. However, the base of his tongue was at 6.6 and stayed at 6.6. Why? He was tongue-tied. So here, there is barely any space for the tongue at the roof of his mouth, and his tongue was actually thrusting forward behind those front teeth. As we developed that upper jaw, now he has a lot more space for his tongue, there's a lot more width there as well, and his tongue didn't feel like it had to thrust forward to stay out of the airway. So now is when we go through myofunctional therapy and possibly doing a tongue tie release, and as that tongue comes up against the roof of the mouth, the base of the tongue comes with it and that will start to open up. So we've done this many times like we talked about before, and I can go over many different cases of how we've grown this airway to where you're breathing more out of a garden hose instead of a coffee straw, and ideally reversing the sleep apnea so it doesn't continue to progress and get worse as we age. I want you breathing more out of this airway than out of this airway. As I'm looking down someone's airway, this is what they look like before and after. Before and after. I'd rather you breathe out of this kind of an airway than in that kind of an airway. This other patient that we treated for 15 months went from 7.7 cubic centimeters of airway volume to 24.1. And the minimum cross-sectional area of their airway went from 120 squared millimeters to 276. So that's another garden hose versus a coffee straw. As we go through this treatment, I'm developing that entire midface. So as you see this person on the left, she has a really long, skinny face. So she was probably a mouth breather for most of her life. When you mouth breathe, everything's gonna rotate down and back. It creates this long face type of appearance. As we develop that midface, you can see how her facial structure changed over time, for the better. Not everyone has these crazy results, but it can happen for a lot of people. This person was also more of a mouth breather, where you have that long, skinny face, really narrow arch, and those little black triangles on the side of their mouth. As we develop that midface, you can see how much more broad of a smile that she has and a lot more facial support here in the midface. Here, everything was sucked back where she had more bulgy eyes because her jaws were literally back into her airway. And as we develop that jawbone appropriately, you can see how much more of a developed facial structure she has. So this is me and my partner, Dr. Erlander. And usually when you think about somebody who has sleep apnea, traditionally you think of somebody who's middle-aged, overweight with a big neck. However, when I was 28 years old, I was diagnosed with high moderate sleep apnea, and I was the top 5% of the world in Ironman triathletes that year. So typically I don't fall into a stereotypical appearance of someone with sleep apnea. However, I went through this treatment myself. I was my own first patient. And so I have befores and afters of my own treatment. And as you can see, as my upper jaw came forward and wider, my lower jaw was able to rotate down and forward and created a much more definitive jawline. So as my upper jaw comes forward and my lower jaw rotates forward, now my airway should be opening up. So I take an x-ray to see what happened. Behind my soft palate, I went from 8 millimeters to 9.6, and the base of my tongue, I went from 12.5 millimeters to 15.1. And look at my head posture. Before, I had a lot more forward head posture where I'm in that CPR position. Now I have a lot more of a neutral spine and I still have a bigger airway. When typically, when you're more in a neutral spine, you're gonna actually have a smaller airway to breathe out of. One of the other ways that we can treat obstructive sleep apnea and snoring is through a process called night lays. With a laser therapy, we can actually stimulate collagen of the soft palate to lift and tighten that tissue. That tissue is actually what vibrates when we do snore. The way we do this is by lasering this soft palate and stimulating collagen production. That collagen production creates a much more tight-knit matrix of collagen that can cause this to shorten, tighten, and lift up, which can help a lot with airway issues and snoring issues. As you can see on this person, they went from 44.2 millimeters to a 40.5 millimeter length soft palate after we did the laser treatment. Night lays is usually 3 to 5 treatments, about 3 weeks apart, and there's no pain or downtime associated with it. The procedure itself is about 20 minutes long, and the collagen goes through its production process over about 3 weeks. We have done over 4,000 night lace treatments here at this office, and I am a clinical instructor for this company as well, teaching other doctors how to go through this process. Since we've done so many of these treatments ourselves, I'd like to show you some of my own patients where we've actually had a lot of success through this treatment. This person was their before and their after one treatment, how that soft palate can lift and tighten up. This patient had tried typical oral appliances and CPAP and had failed all of the sleep apnea treatments up until this point. This is where this patient started first, and then after 30 minutes of her first laser treatment, her soft palate lifted and tightened up considerably. Then that collagen goes through its production for 3 more weeks, and she went from this presentation to this much wider airway without any more treatment. Then we lasered her again, and 30 minutes later, this is what her soft palate turned into. Quite a dramatic difference between where she started and where she ended up after 2 treatments. These are other cases where we can see before and after how that soft palate can lift and tighten. This is my partner Eric Erlander, and between the two of us we have over 20 years of experience and have done thousands of cases with different modalities when it comes to treating obstructive sleep apnea. Obviously, every patient is different and has varying circumstances. There's a lot of different ways that we can treat sleep apnea, whether it be traditional CPAP, mandibular advancement devices, maxillary expansion, myofunctional therapy, and many other modalities. There are obviously surgical aspects as well. But our number one goal here is to increase your quality of life, and I highly recommend you come in for a records appointment for us to talk about your specific case and what could be best for you.